Well, we found out yesterday Robin Williams had Parkinson's disease. We're going to talk about that, or how it may or may not have been connected to his depression and other problems. Dr. James Pinkney of Dallas joining us. KLIF News Time now 7:10.
KLIF News and Information Time is now 7:17. The widow of actor and comedian Robin Williams says not only was her husband struggling with depression, he also was in the very early stages of Parkinson's disease, something he wasn't ready to share publicly yet.
And of course, I think probably everybody who heard that, their first thought was, well, I wonder if that had something to do with the depression.
Yeah.
Or did the depression have something to do with Parkinson's?
A local doctor notes depression and Parkinson's can go hand in hand. To tell us more about the disease and how depression can be part of it, we're joined now live by Dr. James Pinkney, CEO and founder of Dallas-based Diamond Luxury Healthcare, which is a concierge healthcare clinic here in the area. Good morning, Dr. James. How are you?
Hey, good morning. I'm doing great. Well, we've had several studies that show that in up to 50% of people with Parkinson's, they can also have depression and depressive symptoms.
Now, I started poking around, as we lay people do, and of course we go on the internet and we look at things related to various health problems, and we come to all kinds of conclusions that aren't warranted, and we find out things that we don't understand. But I started looking into Parkinson's to find out more about it, and it did say that people with Parkinson's have a lower level of the hormone dopamine, which I understand, along with other things, has to do with a person's pleasure or a sense of pleasure. Is that right?
Yeah, that's right. In Parkinson's, it's a neurodegenerative disorder. So we actually have neurons in a part of the brain called the substantia nigra that die. And when those neurons die, it leads to a decrease in dopamine, exactly like you said. And low levels of dopamine are associated with depression. So that's why Parkinson's and depression go hand in hand. Typically, lower levels of serotonin are the main cause of depression, but low dopamine can also cause depression.
I guess it's pretty hard to speculate on an individual person's condition when you're not treating that particular person, but do you think that may have led Robin Williams to commit suicide?
Well, I think in Robin Williams' case, he's was a very grandiose actor. He used a lot of facial expressions, huge movements. And one of the things with Parkinson's is that your movement actually slows. We call that bradykinesia. And you become rigid and stiff. And you also have something called masked faces. So you can't use the same facial expressions that a person without Parkinson's can actually generate with their facial muscles. So in Robin Williams' case, this is a huge deal. This is his life. This is what he loves to do. It could have definitely affected him and contributed to depression.
Yeah, but I think about people then like Michael J. Fox, who has not only battled his Parkinson's for years and years, but been very public about it. He's gone on to star in a new TV series in which they actually make fun of his Parkinson's just to get it out there. So people deal with things in different ways. And that brings me back to Robin Williams and wondering, is it a chicken and egg thing? Which came first and which was the bigger problem, the depression or the Parkinson's, or, did it go hand in hand?
Yeah, it's going to be difficult to say. I know he's battled with substance abuse in the past, but I read that he had been sober for quite some time. So you never know which really came first, if he was depressed and then the Parkinson's exacerbated that depression. Now, I know he did have some financial issues that he was working through and that he took the job on the sitcom to kind of deal with those financial issues. So he very well could have been depressed and then developed Parkinson's, and that made his depression worse.
We're talking to Dr. James Pinkney. He is CEO and founder of Dallas-based Diamond Luxury Healthcare, and we're talking about Parkinson's disease, which Robin Williams was diagnosed with before he committed suicide. And Dr. James, what are some of the warning signs of Parkinson's that people should be aware of, and when should you seek help or go to a doctor if you have some of these symptoms?
Well, one of the biggest symptoms is a resting tremor. So the hands can start shaking. Like I said before, the bradykinesia or decreased movement. Someone will have a very short, shuffling gait. And when they walk, the hands, when they normally rest down, they usually swing a little bit when someone walks. So in Parkinson's, that motion stops. Also, facial expressions, they become blunted. We call that masked faces. Someone will experience a lot of the same symptoms as depression: decreased appetite, difficulty with concentration, sleep disturbances. And that's one of the reasons why it's so difficult to separate the two, depression and Parkinson's, because a lot of the what we call somatic features, they overlap.
What do we know about the causes of Parkinson's? Anything at all?
We really don't know why this disease happens. There's definitely a genetic component. There's a couple of genes that have been isolated It definitely can be passed down in the family, but we're not really sure why these neurons found in a certain part of the brain suddenly begin to die.
Are there medications that can be used to slow the progression?
Yeah, the most common medication is something called levodopa. So it's a dopamine agonist. It increases dopamine levels, and that's the best treatment right now. There are some studies with the brain implants, deep brain stimulation. Michael J. Fox has that, and that can be promising at times, but it's definitely on an individual basis.
Is there any connection between Parkinson's and people who have, from time to time, the occasional facial tic or restless leg syndrome, that kind of thing?
That can be one of the signs. We call that, kind of a psychomotor agitation. That's not one of the big signs of Parkinson's, but there's a lot of overlap between facial tics like Tourette's or Huntington's disease, where you have large motion defects, and Parkinson's. They kind of there's a spectrum of diseases that kind of all run together.
And this can strike when you're young, as evidenced by Michael J. Fox. I mean, you don't have to be older to get this.
And you can have early onset Parkinson's, and usually it's worse when it is early onset. That is definitely a possibility.
All right. Well, Dr. James, thanks so much for joining us
this
morning and giving us more insight into this disease and how it may or may not have been connected with Robin Williams' depression.
Thank you.